Hi, my name is Dan, and I'm a mental health pharmacist. And today I wanted to do a video about a newly FDA approved medication for treatment resistant depression called Spravato. I believe that's how it's pronounced, which is esketamine nasal spray. And I've already done a ketamine and esketamine video, but this is going to be more specific for the package insert and monograph that Janssen, the drug company that made this drug, just released today. For esketamine's mechanism, we don't necessarily know how it works for depression. We know that it's an NMDA receptor blocker. And one theory of how this works for depression is blocking the NMDA receptor, which is a primary excitatory neurotransmitter pathway in the brain. It can increase the effects of another channel called AMPA, which then can increase brain-derived neurotrophic factor and mTOR, which you can kind of think of like a fertilizer for the brain. So it helps brain cells connect better and grow more quickly and proliferate a little stronger. So that potentially could be how it works for the treatment of depression. The indication for Spravato is interesting because it's very specific. So it's indicated in conjunction with an oral antidepressant. So the studies that the drug company includes, these patients were also on an oral SSRI antidepressant or SNRI antidepressant medication. And then so in conjunction with an oral antidepressant for the treatment of treatment-resistant depression in adults. So treatment-resistant depression means that these patients were tried on at least 2 other oral antidepressant medications for an adequate duration at an adequate dose and still didn't have an effect. So this isn't just first line for depression now. There has to be a few trials, at least that's what's indicated in the data. And then, like I said, for adults, so it wasn't studied in pediatric patients. So just that one indication line gives you 3 pieces of data that are interesting. There are a lot of interesting key parts of the dosing and administration as well that I wanted to bring up. So this is an intranasal product, and it must be given under the supervision of a healthcare provider. It's a controlled medication as well. It's listed as C3. So other controlled medications are things like benzodiazepines and opioids. So it has a little bit more protection and people watch over these types of medications a little more than non-controlled medications. Blood pressure must be assessed before and 40 minutes after administration. And due to the potential for nausea and vomiting with this medication, it's recommended to avoid food for 2 hours before, avoid liquids for 30 minutes prior to administration. And then due to its intranasal administration, patients on nasal corticosteroid, nasal decongestant should avoid administering that within 1 hour of getting the dose of Spravato. The dosing schedule is pretty interesting as well. So for weeks 1 to 4 is considered the induction phase, and it states to administer twice weekly. And you'll see when I go into it later, but this medication has to be given under the presence of a healthcare provider, and the patient must be observed for 2 hours after the dose is given. So for these first 4 weeks, just imagine one of the biggest downsides of this medication is going to be that you're going to have to sit in an office for 2 hours at least twice a week for the first 4 weeks. But back to the dosing schedule. So weeks 1 through 4, administer twice weekly. Day 1, the starting dose is 56 milligrams. Subsequent doses are either 56 or 84 milligrams. Then the maintenance phase is next. Weeks 5 through 8, administer once weekly. So after that initial loading dose of doing it twice a week, it goes to once a week. And then at weeks 9 or after, you can make the duration even longer to administer it every 2 weeks, or you can continue doing it once weekly at 56 milligrams or 84 milligrams. So it's pretty interesting that you start with the twice weekly, then go to once weekly, and then you can progress to every other week after that if the patient's doing okay. Spravato is also only available in a 28 milligram nasal spray. So to get the recommended 56 milligram dose, you would have to use 2 of the devices, of the nasal spray devices. And to get to the 84 milligram dose, you would have to use 3 of the nasal spray devices. And they recommend a 5-minute rest in between each administration, each device. Each device contains 2 sprays as well, so 1 for each nostril. And there are 2 green dots on the actual device. So 2 green dots mean there's still 2 sprays left. So you don't prime this medication, get it ready for spray. It's already ready to go. 2 green dots, you do one into the first nostril, one of the dots goes away, and then you administer in the second nostril, both green dots go away. But I'll go into the specific steps of how to administer now. So it says blow your nose before the first device only. So if you're using a 56 milligram dose and you need 2 of the devices, don't administer the first one into each nostril and then blow your nose and then administer the second product. So first step, blow your nose. Second step is the healthcare professional will check the expiration date, peel the blister pack to remove the device, check for 2 green dots, hand to the patient. The patient then holds their thumb on the plunger and reclines head 45 degrees backwards to keep the nasal spray into the nose, and inserts the tip into the nose, closes the nostril with the other hand, and then breathes in through the nose with the head tilted backwards as they press the plunger in. And then you switch for the other nostril. So make sure you close the nostril with the other hand. After you're done with the administration, then continue to sniff for a little bit to keep the spray into the nose pretty much. Then, like I said before, if the dose is higher than 1 product, which contains 28 milligrams, so for the 56 or the 84, wait 5 minutes and then repeat the administration process in each nostril for the second device and then the third device if needed. So the biggest negative that I see is the post-administration. It says observation is at least 2 hours and patients are instructed not to drive until the next day. So you think about when you go to an office or something like that, you'll probably have to wait in the waiting room for a little bit. Then you get into the actual room. This administration, if you're doing the higher dose, you're using 3 of the products, waiting 5 minutes in between. And then you have to be observed for 2 hours after, and then you can't drive home. So it might be a big pain for patients because they're going to be in the office for a long period of time and they're going to need to find a ride or a way home. So next I'll go into some of the contraindications and precautions that were released today. Contraindications are aneurysmal vascular disease, intracerebral hemorrhage, and hypersensitivity, which makes sense. Precautions, one that I found interesting is the increase in blood pressure. So 8 to 17% of Spravato treated patients had an increase of more than 40 points in their systolic blood pressure and 25 in their diastolic blood pressure. 3% of the Spravato treated patients had their systolic blood pressure increase to past 180, which is concerning. And once blood pressure gets very high, like around that 180, 200 range, patients are at risk for like stroke and some serious side effects. So that blood pressure increase is a little concerning. I guess one tip before you would go to your office to have this administered is try to keep your blood pressure lower that day. Maybe have less caffeine, other things that could help keep your blood pressure low. Next precaution is cognitive impairment. So short-term impairment was seen between 40 minutes and 2 hours post-dose. Long-term impairment has been noted with misuse of ketamine, so they were extrapolating here a little bit. It wasn't seen with 1 year of Spravato use, but they were saying like long-term effects of Spravato past 1 year hasn't been evaluated. We don't know if there's long-term cognitive issues with Spravato. Next precaution is impaired ability to drive, which we talked about. After you're watched for 2 hours after the dose, you're supposed to not drive until the next day. The effects of Spravato on driving were comparable to placebo 6 hours post-dose. So Before that 6-hour time period, there was still some impairments with driving. Next precaution is ulcerative or interstitial cystitis that was seen with ketamine. So they're extrapolating because there were some lower urinary tract symptoms with the esketamine. So just something to look for at this point. And then next is embryo fetal toxicity. So based on animal trials of ketamine, but still wouldn't be recommended at this point, at least for the evidence I've seen in like pregnant people. There are some drug interactions listed on this monograph that came out today. So CNS depressants make sense if some of the side effects are dissociation and sedation and issues driving. CNS depressants like benzodiazepines, opioids, alcohol may increase that effect. So makes perfect sense there. Next is stimulants such as amphetamine, Adderall, methylphenidate, Ritalin, modafinil, and MAOIs, which are antidepressants. Those are all known to increase blood pressure. So with the blood pressure effects of this medication, using those together could cause even a higher rise in blood pressure. Next, I wanted to touch on adverse events or adverse effects. So what they looked for were adverse effects that had reactions that were at least twice that of placebo. So even placebos have side effects, and people will note that. But when they're doing drug trials, they look for at least double the rate of placebo, because then that's more likely related to the drug or the medication. So what they saw here were dissociation, dizziness, nausea, sedation, vertigo, anxiety, lethargy, blood pressure increases, vomiting, and feeling drunk. So a fair amount of side effects. Some have differing degrees of how serious they are, but those are the noted side effects. Medication package inserts can also have black box warnings on them, which are literally a black box around a certain part of the verbiage in the package insert. And esketamine has quite a few things in its black box warning, actually. So first is sedation. 49 to 61% of patients experience sedation in the trials. Dissociation, 61 to 75% of patients experience disassociation. Abuse and misuse, so like I said before, this is classified as a Schedule III product. And then suicidal thoughts and behaviors. So actually all antidepressants have that listed, and this is for pediatric patients. Younger patients have seen higher risks of suicidal thoughts and behaviors, and then as patients get older, that risk seems to go down. This is also a REMS drug, which is a classification of drugs that have higher risks and need a little more control over them as well. So as a REMS drug, what that means for this drug specifically is that the patient must be certified to get the medication, the healthcare setting must be certified, and then the patients must be monitored by a healthcare professional for 2 hours after the dose is given. So these are the extra areas of control that is needed for this drug to be approved. Okay, the last part of the monograph that I wanted to go over quickly is some of the trials that were mentioned in the monograph. So first was the safety and abuse trials. Spravato was evaluated for safety in 1,709 patients from 5 phase 3 trials and 1 phase 2 trial. In these trials, overall, 4.6% of patients who received Spravato discontinued due to an adverse event, compared to 1.4% in the placebo group. These numbers both increased in patients older than 65, so elderly patients had more side effects in both the Spravato group and the placebo group. There was also an abuse potential study listed. So this was a crossover double-blind study of Spravato and ketamine compared to placebo in 34 recreational polydrug users. They looked at a drug likability score to see how much these people liked using it, and they looked at a take drug again score to see if these patients would want to use the Spravato or the ketamine again and again. And they found that the scores were similar in Spravato and in ketamine, and they were both, as you might guess, higher than placebo. So that shows that there is potential like abuse, and that these medications seem to cause like a good effect in patients that are using them recreationally, not just in this case for the treatment of depression. Dependence and tolerance have also been reported with ketamine. So extrapolating this to esketamine for overuse or using it for longer than a year, we're unsure, but it's predicted that there may be some dependence and tolerance to esketamine as well. It didn't specify in the package insert if that tolerance is to the antidepressant effect as well. So I'm a little curious to see what longer term trials will say in regards to if people can become tolerant to the effect of esketamine and will need higher and higher doses to get that same antidepressant effect. So that's something I'll be looking out for as more trials become available. There were also 2 trials included in the package insert, so I wanted to talk about those and touch on those briefly. So the first one was a short-term trial. The second one was a long-term trial. So for the short-term trial, Spravato was evaluated, randomized placebo-controlled double-blind trial in adults with treatment-resistant depression. Patients discontinued their antidepressant treatment that they were on, and then they were randomized to either receive twice-weekly dosing of Spravato, 56 or 84 milligrams, or intranasal placebo, plus they were started on an oral antidepressant medication, and these were either in the SSRI class or the SNRI class, so a typical antidepressant. And they looked at the MADRS depression scale, which is a commonly used depression scale in trials, to assess the change in depression over time. The average decrease was 19.8 points in the Spravato plus an oral antidepressant group, which is good. That's a significant decrease. But compared to the placebo plus the oral antidepressant group, their depression scores decreased by 15.8 points, which is also pretty good. So the 15.8 point decrease with just the oral antidepressant, and these are in treatment-resistant depression patients, so that's pretty good. But that esketamine component added another 4-point decrease in that score. One of my kind of complaints or concerns with this trial is that since it's placebo controlled, and when I was talking about the adverse events before, so many people got sedated and dissociated on esketamine that it's not really placebo controlled in a bunch of patients, because you're going to know if you're on esketamine or if you're on placebo a lot of the times if you are one of the patients that get the severe sedation and dissociation. So there might be some bias or some issues there, but just a thought I had when I was thinking about the trials. Next, I wanted to go over the long-term study that was included in the package insert. So for this study, they took patients that were responders to Spravato they were on it for 16 weeks, and then they wanted to look at the long-term effects. So at this point, they kept the patients on their oral antidepressant medication, but then blinded them to the fact that they were either getting switched to placebo or they would continue on Spravato. And they looked at MADRS depression scores and patients that then had a return to depression. What they found was that the patients that continued on the Spravato had a longer time to relapse into depression symptoms than the patients that were switched to placebo, which is good. The patients that were switched to placebo had a higher chance of remitting back into depression. To give you the specific numbers, 35 to 40% of Spravato treated patients relapsed with depression, which is still fairly high, but compare that with placebo, the patients that were switched to placebo, around 70% relapsed into depression symptoms, which is very high. So I think, to summarize, that it's very interesting that there's a medication with a different mechanism than other antidepressant medications that's been FDA approved. So it seems like there's some progress. There's some negatives with it as well. The 2-hour post-administration observation period is going to be rough for a lot of patients, especially when they're in the induction phase and have to go in twice a week to get their dose. So there's a big time sink with getting this medication. I also like that it was studied in treatment-resistant populations. So these are patients that have tried other things and failed other things and need something different. In regards to the trials, so it wasn't like a magic bullet. We weren't seeing everyone was having a cure to their depression. It's not a catch-all medication. It might be helpful for some patients, but not for others. And then I guess my issue with the trials is the placebo control, because like I was saying before, if patients have dissociation or severe sedation, they're probably going to be able to figure out that they're on the Spravato group as compared to the placebo group. Overall, I'm interested and excited to see more of this evidence, but I hope that this review of the package insert that Janssen released today for Spravato is helpful information. Thank you for watching.